So if you're really interested in system change and using resources effectively, it's much better to actually put parents and listening to parents at the center of that whole process, because that's what's going to ensure more appropriate services and the better outcomes that follow from that. Not to mention, it's actually, that's why it's in the code of practice. Code of practice says parents ought to be met with, ideally once a term. That every child should have a plan. That plan should be reviewed at those meetings. And that all came out of the research that we did at the time that shows that is not just the most effective way of delivering education, but it's the most effective way of assuring better outcomes, because the teachers and professionals understand the needs of the child better. The parent feels their needs and their understanding their child is being incorporated into what's happening in the school environment. That's creating that level of trust. And if you're worried about everything escalating to tribunals and education, health and care plans, well, that's where either building trust and confidence starts, or where it starts to slip away. And if parents feel they're not being listened to, the needs of their child aren't being met, the support and services aren't being wrapped around that child, that's when you get everybody moving through this education, health and care plan. So my question would be, how could you afford, if that is your concern, and we can debate that, but if that is your concern and you want to reduce the number of education, health and care plans, start with really good parental engagement.